Here is a brief introduction to insurance. You must have come across situations in life when you must have faced a loss or gains. Whenever you have a gain, you always feel happy and you are very excited about it. But what happens when you have a loss? You feel terrible. And what if someone was there who would say, I will cover for your losses. You take a risk, but if you have a loss, I'll cover for your losses. How nice that would be. This is exactly what insurance does. So the insurance covers you for your losses. These losses have to be pure losses and not speculative. That means you cannot gamble and say, okay, if I lose, the insurance company will cover me for that. So the insurance company will always cover you for your pure losses, right? Now that the insurance company has agreed to pay for our losses, they will ask us to pay a little amount of money, which will be known as premium. And for that, they will give us a large amount of benefits. So they will take a little money as premiums from us and they will give us huge amounts of money as benefits. When this occurs in life, that means they are covering us for our life, and when we die, they give us huge benefits to our beneficiaries. This is known as life insurance. The insurance company has agreed to pay for your pure losses, but not all risks are insurable. That means there have to be certain elements, only then your risk will be insurable. What are these elements? That the risk has to be due to chance. You cannot predict a risk and then say that it has occurred. It should be a loss which is outside of your control. Then they have to be definite and measurable. That means you can measure that risk and you can determine how much you need, how much benefits you need, right? And then they cannot be catastrophic. That means you cannot say everything is destroyed, everything. No, it has to be measurable. Then they have to be statistically predictable. That means the insurance company has a mortality tables and they predict that this much, with this risk, there are going to be so many deaths. So they calculate that. And they have to be randomly selected. There must be a sufficient large pool of the insured from which they can choose